Hello, my name is Chris Heylman. I'm a professor in the Biomedical Engineering Department. I am an alumnus of Cal Poly. I did not graduate from the Biomedical Engineering Department, but I did graduate with a degree in General Engineering and a concentration in Biomedical Engineering. From there, I went and did my PhD at Case Western Reserve University, and there I focused my studies and research on orthopedic tissue engineering. I also did a series of postdocs at UC Irvine, still focused on tissue engineering, but different organ system and a very different scale. I was working with cardiac tissues and cardiac tissues on a chip. So we're building very small, vascularized human cardiac tissues in a microfluidic chip for the purposes of screening novel drug compounds. Okay, so at Cal Poly, the classes I teach are BMed 455 and 456. This is our senior design sequence. So after you've taken all your support courses, all of your engineering fundamentals, then you get to put them all to work in senior design. So in this class we go and get projects from outside the university, from biomedical companies, from clinicians, from entrepreneurs and startups, and we bring them into the classroom and have our students work in teams on those projects. So they're taking initial customer needs, defining what those are, and then developing engineering specifications, building prototypes, and testing them, so at the end they have a fully validated functional prototype for all these sponsors of these projects. Similarly, at the graduate level, I teach BMed 591 and 592. This is our thesis project design laboratory. So graduate students in biomedical engineering have the opportunity to either do a traditional one-on-one thesis, or they can do a master's project where we have teams of 2 to 3 students working on externally supplied projects. So this coursework accompanies that. It teaches them additional skills that are industry relevant, including project management, professional communication, and we get to apply that immediately in the context of their projects. I also teach BMed 460, which is engineering physiology. So teaching a approach to physiology that is relevant to engineers in their design of devices and their development of therapies as they go out into industry. The last class I teach is BMed 450, which is drug discovery and development. So targeted at our students who are interested in careers in biotech or pharmaceuticals. This course is essentially a survey of the entire process of the development of a drug, a biologic, or a combination device. And so this takes them all the way from the initial discovery of a compound that might one day become a pharmaceutical, through animal studies, through human clinical trials, all the way to post-market surveillance and beyond. So really a nice course that gives you a lay of the land as you head out into industry. My research is along those same lines. I focus on tissue engineering for drug discovery purposes. So we're building tissues on a chip, so microfluidic devices that are the size of a stick of gum. We're growing vascularized three-dimensional human tissues on those chips and then using those tissues to test novel drug compounds and see what effects they have on the cells and tissues. So this will serve as an early stage screening device in the development of novel pharmaceuticals. Really exciting that we have all the resources on campus to do this. We have our microfabrication facility, we have really nice cell culture facilities that enable us to do this really exciting research. Lastly, I'm the advisor for the Biomedical Engineering Society, probably the main club for our department, in which students get the opportunity to hear from industry speakers, to hear from faculty about their research, and really engage with the department on another level beyond just their coursework.